this public transport, it is very efficient actually. I'm so happy about this train system.
Indeed, because it got here on time, and you were able to appear on Sirius's That's
a program today
at 6:30.
And I'm fresh still.
About this latest announcement from the Army Commander, who's of course in charge of the committee to prevent the spread. 250,000, we got 500,000 from India. 250,000 has already been administered to frontline workers, and the President says, well, now that we don't have to administer it within a month, as previously you had to have the second dose within a month, but now they're saying, well, you know, it's actually world opinion is that you can have it up to 12 weeks. And so using that gap period, the President is saying, well, let's capitalize on that and let's do the 250,000, the second round. Is this a good thing?
Well, when it comes to the vaccination, now we have a new hope that vaccine has arrived Sri Lanka and the people, frontliners already received the vaccine. So therefore, we have a new line of action. Like so far what we did was we quarantined the people who got the contacts, and who got the disease were sent to the hospitals. This is and you know, social distancing and other strategies. But vaccine came into the play, and it took a major leap in the COVID control mechanism. So therefore, it is a very, very positive thing, and I think we should thank to President and the officials who took that step in a very quick way. We know that it is very difficult to get this vaccine because all the productions are being ordered already.
Yeah.
All these rich countries are, you know, they are ready to take any amount of vaccines at any time. But thanks to WHO, they have instructed that certain amount of vaccine should be delivered even to the countries like us. So, and also with the understanding of two countries, with India and Sri Lanka, with the involvement of President directly to the, you know, speaking to the Indian Prime Minister, we got this, so we are lucky. When we come to the technical part of the vaccine, now why we are giving vaccine is to boost our immunity against the COVID virus. So this was done in a expedited way of producing the vaccines, but although it has gone in very shorter way, WHO has already given the registration to use this for the human being. So therefore it is safe. That message I want to give it clearly, because
it is safe, because there are people. I'm glad you did that. Yesterday I met somebody and I said, oh look, you know, you can go and get your vaccine now. And that person said, no, I don't want to get my vaccine. I don't want a vaccine. But talking about it, now you say it's safe. Do you feel that there ought to be a rule that everybody must have a vaccine, as opposed to it becoming a personal choice? The reason I say it, of course, is obvious, because if some people opt not to have it, they can then be infecting other people. This is not something. What's your feeling on that?
Now the medicine, of course, really everything goes with the ethics. So therefore, everybody has the right of accepting or rejecting. So we have to obey to that autonomy. So therefore, we can't force somebody to take the vaccine or medicine, any medicine. So therefore, in this case, even we know that taking the vaccine protect the person who takes and the society. Unfortunately, we cannot force anybody to take the vaccine. It is his choice and his right.
Yes, but can I don't know if this is the right parallel, but in the past, when there was this whole commotion about HIV, it is actually against the law in some countries, and certainly in Britain it is, and I think it's the same here, that if you know you are positive, if you're infected, then it's wrong for you to having known that, it's wrong for you to get into a relationship which you will then pass it on. Yes. So in that same sort of parallel, if you don't have the vaccine, and then not only are you a burden on the medical resources of the country, private or public, it doesn't really matter, but there is this risk that you may spread it to somebody else.
True, that is true. That is why now, as a respectable citizen, we must always respect not only your own view when it comes to health. You should also have to take care of the public, I mean the community. So you are part of the community. It is your responsibility to protect the community as well. So in that context, taking the vaccine is very important because it will protect yourself. The one who is taking the vaccine, you will be protected to a significant level. And then taking it will help to build up the community immunity.
Indeed.
So therefore, I humbly request from the public, it is a safe vaccine. It will not cause any major event. So far, there is no major event after taking this vaccine. I think around 250,000 people already got vaccinated in Sri Lanka. Nobody got any major event. So therefore, it is a very safe vaccine. So I think everybody should support to the vaccination program because COVID will never end.
Something we're going to have to learn to live with.
Exactly. So therefore,
that seems to be the popular and growing thinking now.
Yes.
That we're not going to eradicate this, but we're going to have to learn to live with it within certain parameters.
For many more years, I think, because the way that new strains are coming, the structure, the out appearance, and the whole structure is getting changed every day. So,
I'm sorry, and talking about the strain, this new strain, how do we now are told that a new strain that is sort of from Britain,
yes,
has now sort of engulfed us or parts of Sri Lanka, and how does that happen?
Yeah, now actually this new strain was first identified in UK. And they found that some virus is quickly spreading, like very infective.
Right.
Then they started those countries. They always do the viral studies and study the structure of the virus. Though we in Sri Lanka we too do it, but not into the level of UK and other countries does it. So therefore, they understood that there is a new strain, and the functionality or the characteristic of that viral change, the strain, is more infective.
I see.
It is spreading quickly. And now it has been identified in many other countries and also in Sri Lanka. So most probably, somebody who has come from a country where the new strain was there, must have brought it, because this is human to human transmission. So therefore, most probably it has come from somebody who has come from a country where it was spreading.
Which means that somehow, because when you arrive, you get a PCR test done.
Yes.
Either free or you pay, whichever, but it's done.
Yes.
And so obviously somebody may have slipped through the net, or could it be that they got it after the event?
Yeah, there can be many ways that it has happened. Like PCR test itself is not 100% accurate.
Okay.
It is 70% sensitivity, where you can always miss somebody.
Okay.
So that possibility is there.
And why do you miss somebody? Is that because they haven't done the test properly, or is there a problem with the calibration of the testing equipment?
Yeah, test itself has a possibility of missing the disease.
Yeah.
And also the way you collect the samples, you have to collect it properly from the proper place. Otherwise you may miss it. And secondly, how you transport it. It should be, there are procedures that you have to follow.
Okay.
And the identification procedure itself might give false reports. And moreover, the number of viruses available in that specimen might not be enough to detect. So there are various technical problems that encountered with the PCR, which may give rise to a false result.
Right, but it's equal to everyone. So therefore,
yes, it is equal to everyone, and it can happen even in UK or America. It's not only common to Sri Lanka.
Right.
So therefore, it is embedded with the PCR testing itself.
And on that note, let's remind you that you can send us your questions by SMS, please. 0772 300 305. And thank you for your questions already coming in. And one of them is asking, how come the vaccine is being given without apparently testing for any other allergies? Isn't that dangerous?
Yeah, now when you come to this AstraZeneca vaccine, which we are getting from this Oxford, so-called Oxford vaccine.
Is that the one that's come from India?
India, yes.
Yeah.
That the company itself says that there is very less chance of getting allergies.
Okay.
And in Sri Lanka, what we follow is like we take a detailed history from the patient, from the person, and if there is any, if we identify any chance of getting him to an allergic reaction, we take extra precautions.
And what would some of these matters be? What some of these items? What would lead to a to you as a doctor thinking, right, you know?
No, for example, if you had a major allergic reaction to any other drug before, right? So that is one of the concern that we have. In that case, we take them to a safer place like, you know, ETU or somewhere, and then we vaccinate. We will not ask him not to get vaccinated, but we will take precautions before giving the vaccine.
I see.
And for example, my colleagues who had several reactions to the drugs, they safely had the drugs in the hospital, so there was no problem as such. And many of our colleagues, you know, all our staff got the vaccine. Nobody had any major concerns, you know, small aches and pains and little bit of malaise in the next day, on the next day. Otherwise, we were very safe. I myself, I took the vaccine. I don't get anything to say that, you know, vaccine gives us any reaction or something.
Right.
So therefore, it is a safe drug. I think everybody should get it.
Excellent. Let's take a look at what the headlines are going to be for Primetime News. Don't go away. After this short break, we'll come back to Newsline Live.
Newsfirst, Newsline with Faraz Shaukat Ali. Newsfirst, Newsline with Faraz Shaukat Ali.
Well, exciting news coming on the Primetime News later on this evening, but welcome back to Newsline Live. Dr. Samantha Ananda is our guest here. Now then, from the GMOA actually. Now then, the many questions coming here, but somebody's saying to me that you haven't really answered the question about the first one, about what the commander said.
Yes, exactly. Now, according to the previous data, it was asked to give a booster dose after 4 weeks.
Yeah.
Like you get the first dose, and that will give you immunity to nearly around 50%.
Right.
And they advise to take another dose after 1 month, so that your immunity will rise to level of 70 to 90%. So that was the initial instructions. But now WHO says that if you give it in 3 months, like 12 weeks, it will give much more better immunity. So based on that information, now countries are tend to give the booster dose after 3 months.
Right.
So therefore, I think President must have advised, assuring that the next lot of vaccines will come before 3 months.
Right.
So that the first lot will not miss the second booster.
I'm a senior citizen from Devada, not far from me. How can I get the vaccination at the earliest at a point in my location? The website I tried to register says it's being updated now for many days. I have the same problem. I tried to register.
Yeah. Now it's like this. Now we got only 500,000 vaccines from India.
Yeah.
And now government has put a order around 80 million vaccines. And with that, of course, according to the State Minister, Dr. Mrs. Fernando Fulle, the general public will be started vaccinating by March.
Right.
March 2021. So therefore, in that situation, the senior citizens will be in priority. So I am sure the epidemiology unit will arrange the priority list.
Right.
And they are the senior citizens, the people who have other diseases will be given the priority, of course. And also there is a concern now, this disease in Sri Lanka is being spreaded among the working crowd. So there will be definitely a priority to the working population as well. I mean, the people who are employed and traveling mostly. All these strategies are made on the basis of controlling this disease. So I am sure expert will take the correct decision at the correct time.
Thank you. And I must apologize. I got doctor's name wrong. Dr. Samantha Ananda.
Yes.
Thank you. And here we go. How safe is it for a cancer patient with stage 2 diabetes, cholesterol, and very low white cell and platelet count? Allergic reaction to plasma as well.
Yeah, well, now when you have chronic diseases like diabetes, high blood pressure, so they are more vulnerable according to the statistics available. They are more vulnerable to get complications. So therefore, we are very cautious about people who has these chronic diseases, and we have already issued set of advices how they should prevent themselves getting the vaccine, I mean the virus. And regarding the vaccine, we will be having different setups for them to get the vaccine. Now, for example, when we are vaccinating the health staff, there were certain staff who had severe allergic reactions before. So we had several hospitals which were dedicated to get those complicated staff to be vaccinated in those centers, like National Hospital of Sri Lanka was arranged to get vaccinated for these people who had other diseases and the allergic reactions previously. So those things have been just evaluated. The concern has been taken properly.
Yeah.
So health is ready to vaccinate everybody. So there is nothing to worry about it.
Right.
Yeah.
And now, how effective is the vaccine that has been brought down? And is it a problem for people with medical complications?
No, there won't be any problem. The vaccine can be given to anybody. There will be certain specific situations, very selected crowd will be in trouble of getting the vaccines, but mostly 99% of the population is, I think, eligible. But the vaccine cannot be given to the people who are below 18 years. And to the pregnant mothers as well as to the lactating mothers.
Is that because of a medical issue or
no,
legal
it is not
issue?
been tested on these people.
I see.
So
Okay.
therefore, you can't.
And question to Dr. Samantha Ananda. What is the possibility of introducing home quarantine for the Sri Lankans coming back to Sri Lanka if the PCR is negative?
Yeah, that is a good thing, good concern nowadays. Is been discussed. So now this is being discussed in the expert committees. Now we are thinking of a methodology where we can introduce such a system so that that will reduce the burden to the health and the army people who are engaged in the quarantine process, as well as to the people who are coming from other countries, because they have to pay huge sum for the hotels and so many other difficulties. So I'm sure that very soon the expert committee will come up with a solution.
I'm a foreign national having a residence visa. Where would I be placed on the vaccination list? And am I able to get vaccinated in Sri Lanka?
Well, that is not yet decided how we are going to do foreign people who are living in Sri Lanka. But as a principle, when it comes to the health, we have no restriction in Sri Lanka whether he's a foreigner or a citizen of Sri Lanka. We equally treat them. So therefore, I am sure that government will have a methodology or the system where we can take care of them as well.
And is this a one-time vaccine? Is it a once-in-a-lifetime vaccine?
No, not of course.
No. Okay, the sound is this problem. Some people are experiencing a problem with sound. We will pass on the comments to engineering. How do we register for vaccine? But the website's down. But you've already answered that question. Now, Doctor, can you tell us, this is absolutely safe, right?
Yes.
So,
when WHO says it's safe, and the experience that we have already got from the world figures, it is safe, I mean, we have to go with the facts.
we have no other choice.
Yes.
And the efficiency is it potent enough, the vaccine?
Yes, it is. It has a significant level of immunity boosting effect. So the people who get both doses will get around 70 to 90% of immunity against the vaccine. So I think it is a significant level of immunity.
But in all cases, we need to be aware that vaccine or no vaccine, you need to do your hands, face mask, and your distance.
That is very much important. I mean, all these other things, vaccines and medicines and so many other solutions are coming up. But leave aside all those things, by practicing the safe medical practices that already been declared will protect you from COVID. So please, I humbly request from the general public, adhere to those. So far you all were doing very well. Help us to continue this. I am sure that if we continue this with the vaccination program, over a year of, over a year or so, we will be able to get rid of this problem, because Sri Lanka should run forward. I mean, we have to move forward. We have to have a normal life as soon as possible. So this collective work will definitely defeat the virus.
And Sri Lanka, how safe is it? A bit of a gamble when the government says, well, let's use the other 250,000 now, and because we've got 12 weeks to play with. How confident are you?
It's like this. I don't think that President declared that based on his own opinion. I'm sure that he must have discussed with the epidemiology unit, where the experts are there regarding the vaccination process, and the other stakeholders who are involved in this whole COVID prevention program must have properly evaluated, and based on those facts, President must have declared that I can't say that it is any arbitrary saying, must be with much more responsible saying. So therefore, I think we don't have to worry about it.
And the Attorney General has today cleared the purchasing agreement between our country and India.
Yeah, I think it is widely discussed and consensus reached statement.
Dr. Samantha Ananda, thank you very much. It's been absolutely instructive and informative. Thank you. Especially thank you because you came all the way on a train from Kandy, and you've done 2 programs for us. Thank you ever so much.
Thank you very much for
inviting. Thank you on behalf, we thank you on behalf of all the frontline health workers because they're doing an absolutely champion job.
And thank you for the media. You all do a tremendous help for us to go forward.
It's our pleasure representing the people always. And on that note, you can follow this story more on the Primetime News. That's to follow in a minute or two. Take care, great evening, and God bless you.